3:01 by my watch. I'd like to call the meeting to order. Welcome everyone here. We have many guests and of course all sorts of important people. So what helps us all is to remind each other who we are. So we'll start off with our vendor. Why don't you tell us who you are, who you represent, and why you're here.
Hi, my name is Arvinder Singh. I'm the CHIP coordinator at Lake Health District, Lake County.
I'm Christy Albertson. I'm the grant writer for Lake Health District.
I'm Cece Montgomery, and I'm with the auxiliary and community, and I kind of serve wherever needed.
I'm Diane Clay, and I'm with the Hospital Auxiliary and the Lake County Food Share.
Vicki Taylor, Climate Family Head Start, Lakeview site.
Beth Hadley, Public Health.
Janine Sims, I'm a nurse in the clinic.
Maddie Munson, OHSU nursing student and nurse in the hospital.
Paul McGinnis, Greater Oregon Behavioral Health and the Eastern Oregon Coordinated Care Organization.
Francie Winters, Prevention Wellness with Lake Health District.
Shreddy Morgan, Lakeview Gardens, and Lake County Senior Center.
Larry Coulter, Administrator in Training for Lakeview Gardens.
Alana Shamulak in Eastern Oregon Healthy Living Alliance.
I'm Charlie Twait.
I'm Michelle Hansen, Food Corps.
Rod Harwood, Older Adult Behavioral Health Specialist with Greater Oregon Behavioral Health Department.
And Jimmy in the back.
Yep, Jimmy Hall, examiner.
Thank you. We never want to forget Jimmy in the back, even though he's quite quiet most of the time.
It's my job.
And Charlie, we also have somebody on the
Oh,
phone.
who's on the phone?
Could you introduce yourself? Mindy Bentley with Advantage.
Hi, Mindy. Welcome. We're glad to hear you. So the first thing I'd like to do is have everyone review the minutes we've sent out. And if you haven't had a chance to see or read the minutes, please do so. And then once you're ready, if you could have a motion to approve the minutes, that would be great. Not hearing any corrections, could I get a motion to approve the minutes? Cece?
I approve the minutes as presented.
So you're making a motion that we approve?
Yes.
Excellent. Do we have a second?
Paul second.
Thank you, Mary. It's been moved in second. All in favor, please signify by saying aye if you approve.
Aye.
Same sign if you disapprove. Thank you. Minutes have been approved. So our next item is Paul with some an update of impact in Triangle.
Yeah, the impact statement was as a result of the last item in the minutes that we read about the expansion of the Oregon Health Plan. Essentially what we're dealing with right now at this point in time, regardless of what's going on at the federal level, is that our state needs to decide how many people are going to be on the plan based on their ability to pay for the portion that expanded it. And so what we're looking for in a memo that's in your packet is simply people's stories about how being on the Oregon Health Plan has impacted or changed them. And we'd like to try to get one or two stories from each county so that we can use that with our legislative process to try to make impact. You can talk numbers and dollars all you want, but it's the stories of how people have been impacted that make a difference. And, you know, we had a community meeting with a number of plan members in Sherman County, and, you know, overwhelmingly, people simply said, you don't know what kind of relief it is to actually know that I have insurance now. And then their complaints were the same ones that I have with my insurance. I mean, it's just another, it's a big bureaucracy, but the difference was that sense of relief. So if you know someone that's been impacted by being on the Oregon Health Plan, if you could have them follow the directions in the memo, that would be very helpful.
Jimmy, is that something we could get in the paper? Sorry.
No, he's not here.
Maybe we can ask him later when he comes back.
Yeah, he'll be back in 15
Oh, okay, good.
Arvinder, if you could pull up that presentation.
minutes. Yeah.
Just real briefly, I wanted to talk about health districts in Oregon and what they are, what they can do. There's been some discussions in other LCACs around the wording and names. Yours is called Lake Health District. Oftentimes, people still use the word hospital in it, Blue Mountain Hospital District, but it's not a hospital district in Grant County, it's a health district. And so I just wanted to do a little primer on what health districts are in Oregon and what we may be able to think about in terms of the role of the health district, both here in southern Lake County and the North Lake Health Districts. They have the same exact roles and responsibilities. So next slide, you have this presentation in your packet. States allow three things to exist, really four, but they allow cities to exist, they allow counties to exist, and they allow special districts to exist. They also allow public corporations. OHSU, Oregon Health Sciences University, is actually a public corporation, just like public broadcasting, and they have special rules, but they're a really small piece. You're either a county, a city, or a district. Districts can have lots of different responsibilities. There's soil and water conservation districts. I believe this LCAC was looking at trying at one time to propose a recreation district for the community. There are school districts, there are cemetery districts, there's a number of different special districts. Fire districts, these are what they call municipal corporations, local governments that have legal and ethical obligations. They have a specific geographic area for the population. You can draw a line around it and you're included in the property or you're not. They receive tax revenues as a result of this, and they have a publicly elected board. So when the health district board, when people come out for vote, you guys as citizens get to elect the people that go on. Next slide. The purposes of the health district. This is about 15 to 20 years is when they changed it. Actually, a long time ago in Oregon, hospitals and ports, like the Port Authority of Morrow or the Port of Portland, were clumped together in the regulations for that. And you think, well, how did ports and hospitals get together? Beth will tell you, though, that hospitals were built in port cities first, in Philadelphia and Charleston, to stop diseases from entering the country.
Those darn sailors, right?
So anyway,
One way.
the legislature wisely split them out, and they ended up saying they're not hospital districts, they're health districts. Part of the reason for that was Condon, which didn't want to have a hospital but wanted to support their primary care clinic through the use of the district. So as I look at what they've written now, 25 years ago or so, you think what wisdom they had to give it such a broad purpose, especially as we look at integration of health services in rural communities. So they can provide any clinically related diagnostic or rehabilitative services on an inpatient or outpatient basis. Provide outreach programs in healthcare education, research, and patient care. be a resource to providers. So essentially what that means, if there was a private business in the community, it doesn't happen very often, but the district could support, you know, a private activity in the community because those providers are in the district, and promote the physical and mental well-being of district residents. That's pretty broad. If you go into the next slide, powers, essentially what you get down to at the bottom is to perform any other acts that in the judgment of the board are necessary to accomplish the purposes of the first part. So when you look at physical, mental, oral health, all of those services, they could easily be considered an activity of the health district. If we were talking about housing for folks, that's a health impact, right? I mean, those are things that districts actually have a broad enough base that they could get into if they wanted to. Most probably won't, but just know how different these things are than just supporting a clinic or a hospital with tax revenues. Next one. So this is a map of the health districts in Oregon. You'll notice right away it is an urban and rural divide. There are no urban health districts. They're all in rural, along the coast and in eastern Oregon. So anything that's dark is a district over on the coast. They either supported clinics or hospitals for the most part. No urban areas along the I-5 corridor have health districts at all. So you can see we have 2 in Lake County. There was one at one time, then it was split. Then I helped people up north form theirs about maybe 10 years ago, I think, somewhere in that area. But I worked very closely with Alan Parks and those guys up there to get that to happen. Next slide. So these are clinic services. These are districts that support clinics. And I just wanted to point out the North Lake Clinic, the total valuation of the properties up there in the 2014-15 tax year was about $198 million. They have a permanent rate of 85 cents per thousand. So if your house is worth $100,000, you're going to pay $850 a year to make sure that that clinic is operating up in that community. There's some averages over here. Take a look at this one though, the North Gillum Health District. They raise about $550,000 to support a primary care clinic that's run by PAs. You can thank Waste Management and wind farms for that. They can generally be, I mean, if they really wanted to get their act together with that kind of revenues and that small of a population, they could be the healthiest place in Oregon. They really could, but it's just different in how they approach it. So you can see the per capita taxes over on this side. They're about $76.89 per person in North Lake. Next one's hospitals. For the Lake Health District,
Just got named a little bit wrong.
valuation is, that's what's actually still in the tax table, on the tax tables.
You know that it was never Lake County Hospital? No. It originally was, when it was formed in 1967, the organization was Lake District Hospital. And then the legislature changed it to be the Health District, and that's when it changed its name to Lake Health District.
Okay.
But it was never Lake County. Isn't that crazy? And still we have people that, I guess it must be the tax rolls.
Yeah, Harney County's was run by the county and then they put it in a district. But anyway, you can see that your per capita tax here is, or your tax permanent rate is $2.03 per thousand. $100,000 house, you know, it'll be $203.
I'm curious, back at your previous slide, this, you said these are all hospitals. Previous slide, you have Umatilla Hospital.
It was a hospital. In Umatilla, Oregon, it closed.
Okay.
Same with Malheur Memorial Hospital in Nissa, it closed. Same with the hospital in Toledo, it closed. But they left the district in place to run primary care.
Okay, except that, I didn't even know there was a hospital, that's why.
These averages are, they kind of get whacked when the numbers are small. On the prior slide, when you look at the North Gillum one in Arlington, at their amount of money, it gets it out of whack. The other one that gets it out of whack is that Bay Area Hospital in Coos Bay is a district, but they tax nobody. And they obviously have a huge population, so it skews these numbers a bit. But if you want to look and see what Lake compared to others is, you know, you can do so. Next slide. So just why people form these things, just think of it this way. Do you remember your first real job?
Yes.
What was it? At the Pizza Villa. You got how much per hour?
I think it was like $5.
Okay, so she's getting $5 an hour. She works 40 hours a week in the summertime, right? So you're thinking your check's going to be $200, right? And then when you got your check, what happened? Who are all these people taking my money? Who is this Fika guy? What is this, okay?
Really?
What does that got to do with this? Well, think about it this way. Most money that's spent on healthcare is spent before anybody consumes any services. Most money that's spent on healthcare is spent before anybody consumes any services. She looked at her check, and right on there, now it says Medicare. So a portion of the money that she earned was sent to Rockville, Maryland to fund the Medicare program. Down a little lower, it said State of Oregon. You were working in Oregon?
Yeah.
Okay. It says State of Oregon, and she sent money to Salem. And for that dollar that went to Salem, a general fund dollar, how much of that do you think goes for the Oregon Health Plan?
30 cents.
38 cents is what it is now. How much for education?
20.
About 56 cents. You add those two things together, there's only so much the legislature has to really play with in general fund dollars. All right? If the Pizza Villa provided insurance for you, health insurance, but they were generous, let's say they did, they're going to pay a premium every month for her. And that check is going to be sent to Portland, or maybe when KFSB, Klamath Medical Services Bureau came, you know, there used to be an insurance in Klamath County. The premium would have went somewhere else, right? If there's no health services in Lake County, people are still going to spend about $10,000 a year on health care, whether there's services here or not. You're still going to pay Medicare taxes, you're still going to pay Medicaid, and if you can, you're going to buy insurance. So that money all leaves. And so if we don't have a clinic or a hospital here, we can't recapture any dollars that we're already going to spend. So it's wise. Not only that, if you look at the jobs and the infrastructure, are people going to come to communities that don't have health care? And then once you go walking around a hospital, you'll see no more diverse of a workforce than anywhere else. If you go out to Collins and you look at the workforce, they're going to be very similarly demographically, right? But in a hospital, you can have someone who does infection control who didn't finish high school working next to somebody who has an MD. There's jobs for people with high school, with baccalaureate degrees, with 2-year associate degrees, with people for master's degrees, PhDs. I mean, it's a great opportunity for people in Lake County to train and stay in Lake County. But I do think the biggest issue for most of the people that form health districts in Oregon is this last one. It's social value and peace of mind. That knowing if I have my heart attack, there's a hospital in the place. Which is why they often say the emergency room is the window to the world on the hospital. So I just want to make a point that when we talk about all of the services that hospitals and health districts can do, for instance, becoming, you know, the community mental health provider, it's all part of it, and it provides a real organizational vehicle for integrating services within both sections of Lake County. So just wanted to make that presentation since it's come up at a couple of different places about what health districts can do, and it was fairly well received in Harney last month when I did it. Any questions?
What was it you said that most, was it health issues that right now, the first sentence you said?
Most money spent on healthcare has been spent before any services are consumed,
Okay.
right? So you send all that money out of the county. If you decide that you're gonna go to Klamath Falls to get your primary care or hospital services, the money from, if you're a Medicare recipient, goes to K Falls, doesn't stay in Lakeview. And, you know, with the, I think you guys have like 4,200 people or something like that in your district area, and they have about 3,000 up in the north part. But like I said, the per capita expenditures for healthcare now are $10,000 a year in the US. That's about $42 million for the 4,200 people in this area. And if you don't have services, you can't recapture. Charlie, what's your total budget?
About $24 million.
So we're gonna have leakage in rural areas. People are gonna have to go for invasive cardiology and oncology services and other things that you can't do here locally. But it's the district's ability to get tax revenues that allows services sometimes to exist that would not have been profitable on their own.
Thank you.
Thank you.
You bet.
That's very helpful. Christie, you're up next.
Up next, awesome. So, Lake Health District is looking at taking on the summer food program. It's been a few years since we've had it in the community, and at the state level and those we've talked to locally, people are excited about bringing this back. And Rochelle, I'm gonna be hitting you up for some stuff. So we have to go through the formal process of applying to be the sponsor, to actually run the program. That'll happen, I'm hoping in the next week. I just found out about a second one today, an opportunity to apply for a couple of grants. One of them, the deadline has already passed, but they're gonna let us apply and get in by the end of the month to get some extra dollars to help run this. Telling all of you, because this takes a huge volunteer effort, huge, like huge. Vicki is the last one to run this thing, so we're gonna be relying pretty heavily on her. I've touched base. We're still, like I said, haven't even applied yet, but already putting out feelers for volunteers. Talked with Will, Kate, as Vicki had mentioned, 80 Hay as a possible site. That's not gonna be an option. They're doing rebuilding the playground.
Oh,
So
okay.
month of July, it's gonna be dangerous, and then come August, it's soccer, morning, noon, and night on that field. So Fremont is a possibility, but we've also talked with Roberta, the city manager, about just going back to the pool, which is where it used to be back in the day. And that's looking like a good option. Talked with Francie just briefly about programming. The library is interested in being involved. I've heard from at least one business about wanting to be involved, so spread the word and I'll keep you guys posted as we learn more. This will be a good thing to do in the community. We're looking, I just talked to Charlie before we came in here, figuring out ways. One of the grants we might be able to use to help us get the food to places. Only the southwest corner of Lake County is eligible. So Paisley's out, Adel and Flush are out. It's basically Lakeview, West Side, maybe Bly. I will check on Bly to see, and New Pine Creek. So those are
Is that just for summer or for during the school year, the backpack thing we talked about?
That's just for summer.
Just for
I don't
summer,
know about
okay.
anything beyond
Okay.
summer. So, not a dollar flush, they're not, it's just the southwest corner, I don't know why.
I think some of that, we talked to them at the last UPIC meeting, and John Epping was up there, and he
Yeah.
was asking about it, but then he started thinking about it some more, and, you know, some of that issue is those kids they're really, a lot of them bus. There's not
Yeah.
like such a central
Yeah.
area, so
Yeah.
that might be really hard to feed those kids a summer lunch program in that, under those
Yeah.
circumstances. So
Yeah.
I think that's probably a logistics issue.
Adele's Flush as well.
Yeah, yeah. So we'll, as many groups as we can get involved, as soon as Irish Days is over, we'll talk to the chamber, I don't want to bother them until Irish Days is over. Churches, if anyone has connections to local churches, they would be wonderful to volunteer. Seniors, we talked a little bit about your ears too, if there's anything we can do to connect seniors. And Andrea, with the power to drive meals to places, I've been reading up on joining forces with Meals on Wheels deliveries that might be a possibility, so can we talk about
As far as volunteer labor goes, have you considered talking to the COIC?
Yes.
Okay,
Actually,
good.
I talked to Francie about that. I'm gonna talk to Brandy Harris at the school tomorrow too, and yeah, as many people as we can pull in. Actually, I had Cheryl Cornwell's daughter is in Honor Society, so talking about fundraising some of those kids too. They always need, they're now a whole fresh crop of juniors coming in who are gonna need those service hours and, yeah, programming. If it doesn't mean fun, do you think Christy Gray would come and do rocks, just thinking about different programming? That was one thing I talked with the gal at whatever the state USDA office is. They're really excited they want to do this. But she said that the food is really kind of the value add. We know that's the point, is we're feeding hungry kids, but we don't want the message to be, well, you're poor and we're giving you food. It's, we have this fun, family-friendly activity, come hang out with us and we'll feed you while you're here. That's kind of the idea for that, so.
Removing the stigma.
Exactly. I really want to organize a Foursquare tournament in that parking lot. So, just a dream.
Yeah.
That's what I know so far.
Thanks. Thank you. Our vendor, you're up.
Thank you, Charlie. Good afternoon, everyone. It's so nice to have all of you. Before I get into the CHIP updates, Alana, you wanted to share some of the events?
Yeah, I just have a quick EOLA update and a handout, and I'm going to be short. I only have about 15 of them, so some people are going to have to share. But John couldn't be here, so he just wanted me to give a quick update on all of our programs and how we're doing. So our Healthy Happy Smiles program, our mental health program, you can see I have our percentages of students, eligible students that were screened, and then eligible students that received preventative services, which was either the fluoride or the stimulants. Hardin County and Grant County, we had great numbers. Baker County and Malheur County, not so much. So in an effort to get those numbers up, we do have some additional dates coming up in Malheur and Baker counties. Grant and Harding are kind of on the back burner for now until we start getting into prepping for next year. We're doing a lot of community outreach this spring and summer, attending health fairs and meetings and all sorts of fun stuff. We were awarded our year 2 grant. We got $70,000 from the Oregon Community Foundation, so we have a definite another year of that. And we're currently working on our final report to share with all of our community members. So hopefully by next month's CAC meeting, I'll have that out. Mental health first aid. So we partnered with trainers to provide training. 13 trainings were provided, and we are currently seeking funding for the next year. So hopefully we'll find something and be able to provide some more training. We focused on teachers and law enforcement, but we do want to expand outside of that as well. So that's our goal for that. The colon cancer screenings, we had 5 focus groups, and the final report is on our website, so everyone can go check that out if they want to. And on Monday, we submitted our grant proposal to the Night Cancer Institute for screening outreach projects in Sherman, Gillum, Morrow, and Union County. So we're just waiting to hear back on that. Integrated nurse home visiting is building upon existing programs. And right now we're just working on a focus group, and we'll submit a letter of intent to try to get funding on that. And then we encourage everyone to follow us on Facebook and Twitter. That information is down there at the bottom. And then on the back is just the EOLA programs by county, so I won't go through all of that, but it's everything by county that we've been involved in this year. Yeah.
Thank you, Alana.
You're welcome.
Coming to the CHIP updates, Christy, can you give the grants update first that you did?
Going rogue. So in case anyone hasn't heard, we were awarded funding for our third year of the school-based dental program. So yeah, $50,000 to keep that going for another year. And going kind of off the rails here, but our vendors done a really good job building bridges with the schools, especially the Lake Creek schools. I just want to make sure everybody acknowledges that he's done well in building bridges. We haven't always had, there's been some friction. I think that's the good way to say that. And I think we've got the next training coming up in a month, and I think you've done an awesome job.
Christy, who was the 50 from?
That's from OCF, that's that.
Oregon Community
Yeah.
Foundation, okay.
Yeah. And that's the one that they partnered, I think they had money from Ford Family and several different vendors. We also, if you haven't heard, we were successful, all three proposals that we submitted for the EOCCO dollars, we were successful with all of those. So we're going to be able to do the Outback Strong campaign. It's going to live. Decided to get some dollars and start going on that we can get. In one of those, we budgeted for a graphic artist who can create a logo. The idea being that that'll be available to everybody who needs us. We have one consistent something so that we can use it, so that the clinics are using this, so that we're all using the same branding. So the real purpose, I mean, I'm excited about the marketing side of things, but is, again, we're doing, we want to bring up our developmental screening numbers, effective contraception use, the diabetes, HbA1c measure, that's all in the, what were they called, community benefit, whatever that set dollar.
Your
amount is.
LCAC dollars.
Yes, the LCAC dollars. We are going to be part of a colorectal cancer opt-in program where a third party is going to handle mailing kits, and there's really going to be very little, we hope, for you to do. We're going to have to do some hand holding, but little for the clinics themselves to do, and this, we hope, will boost the colorectal cancer screening numbers in Lake County, which are pretty disappointing, as you guys all know. And then the other one is the health fair, working with the schools. Will isn't here, but he, since his previous school came out, and he's excited about this health fair that's going to happen in June. I don't remember the dates. We got it cleared with Bobby because it all was around the 6th grade field trip and Bobby's track and field schedule. So we think we have dates, acceptable dates, and the vendor's working on the coordinating for that. Most exciting, we're going to get the Wonder Bike, I think, unless it's one of the contingencies you're wondering about, Paul. I haven't actually talked to the folks yet, but I think we're going to get the Wonder Bike. Pedal, and it'll make us move.
I think they
Oh,
can,
really?
See?
I think the contingency on the adolescent well clinic, I think, was making sure that you had a more formal relationship with your clinics. Because ultimately what those wellness fairs are about is to make sure that there's an adolescent well visit that's built. So I think that's the only thing I learned.
So the Wonder Bike lives.
Oh, all right. Good. That's okay.
Thank you, Christy.
That's pretty good, folks.
Yeah.
Nailed all 3 grants.
Yes, yeah, exactly. Yeah, it was, Christie was responsible for that.
Now get to work.
Tell us what to do.
I had one question, Paul. Do you know when we will receive the EOCCO dollars?
I thought they were trying to get the money out by March 15th.
Yeah, and also next week I'll send a mail to all the LCAC members and the attendees, just reminding about what the incentive measures were that we chose and how we wanted to go about it. And coming to the CHIP updates.
Just one other comment, Chrissy. The OHSU reviewers responded very well to Outback Strong.
Good.
They liked the concept of positive community norming, and
Good.
In fact, Ann King is going to be coming to our next meeting.
is she? Cool. Ann King, she's with OHSU and was the lead of the reviewer, so.
She was out here about 10, 12 years ago, I think helping with Dr. Graham's, something with Dr. Graham's office, but would like to come to meet committee, LCAC meeting, so we'll have a chance to hear a little bit more and ask her some questions. I'm sure a lot of it's going to be about making sure we spend money well.
Going back to the dental screening update. So as Krishi mentioned, we got the funding for the third consecutive year. However, we do the screenings during the winter in the year, but this year is going to be an exception because we didn't have a very good turnout last winter. So we are planning to conduct a screening in April. It's going to be on April 12th or 13th to capture the numbers that we lost out on. And I have been coordinating with the principals and the people at Advantage Dental. And mid-March, the school district sends out mails to the parents reminding them about the parent-teacher conferences that happened in April. So Susan Warner is going to attach a dental screening flyer with that packet so that the parents are informed before. And I'm also going to call and inform them weeks in advance.
All the parents?
All the consent forms that I have that we used out on. Yeah, probably not all the parents. And still the screenings in April are going to still take place during the parent-teacher conference. However, once we do it successfully, coordinating, because the school district also had some complaints that during the last winter screening, there wasn't a proper coordination of the program. Parents weren't reminded, and there were some other issues, which I guess if we conduct it successfully this April, I'll be able to get their trust back. And they have said that for the later winter screening this year, they will allow us to do it during the regular school hours.
It's a big step forward.
Yes. So I guess it all depends on how it goes in April. And I've also been in touch with the people at Advantage Dental, and I have a meeting with them next week where they'll probably give me the consent forms that they have, and they're also on board with conducting the screening in April and in winter. Coming to the next telehealth telemedicine grant. It's been some time since we were awarded this grant. I guess we were awarded in November or late October-ish time. Yeah, but I've been having a hard time about how I want to go about it. But there's some good news. I've been in touch with the wellness department with Trace Swanser, and she thinks we can definitely utilize this opportunity for children's division for behavioral health. She's still working on the details. The last time I spoke with her, she told me either in the wellness center itself or in the Marriott building, they want to have some space for it. So I've been also working with Polycom, who is going to provide us with the equipment for the telemedicine grant, and also with people at Peace Health. So the people at Peace Health are very excited, and they're just waiting a go ahead, and they'll provide us with their 24-hour crisis workers, behavioral health. And with the people at Polycom, so my discussion with the wellness center, we are not going to get all the equipment at once. We're going to probably get it in increments as we get a more broader idea how we want to utilize it. So I'm still working with Polycom how we can, just to get the equipment, what all processes necessary. And we should definitely have, I'm hoping to get the equipment before the end of this month, but we are still working on that. Coming to the Gatekeepers program, Gatekeeper program has undergone some changes since the last time I mentioned it. The last time we spoke about it, the plan was to send out surveys and also have surveys online, either on the Lake Hill District's site or the senior center side. But after I had more discussions, especially with Mr. Rod Howard and the people in Council of Aging, Lake and Klamath, and also Eric Sorensen, we weren't very optimistic that if we send out survey through mails that we're gonna hear back from them. And also that we did not add any incentive. We didn't incentivize the budget. We did not add anything where we can offer some incentive for them to fill out the surveys. So I was thinking how to tackle this. So after having good discussions, we came to this conclusion that I should probably work with Senior Center, who's also partner with us in the Gatekeepers program, so that I'll hand out the surveys to them, and probably during your meals program, you can hand out the surveys to all the seniors that we can capture there. Then I'm working with Eric Sorensen, where we can probably coordinate with churches and get seniors to fill out the surveys. And I'm also gonna work with the assisted living, the long-term department, to see if we can capture any seniors that way. And also to get seniors who are at Christmas Valley and Plush. I'm also working with Eric Sorensen, where we are devising a way where we can give them the survey and get back. We are still gonna send out the surveys through mail. And we had estimated that we'd be sending out surveys to 2,000 seniors. I don't know if that's going to be possible, but that leaves us some budget where we can probably send an introductory letter first, just informing them that there's going to be a survey sent to you. And because as Mr. Rod Howard told me, through his experience, he thinks the turnout is better that way if they're reminded.
And those letters come from agencies and people they know.
Yes, so I'll probably get an agreement with all the partners that are involved with the Gatekeepers program and send out an introductory letter, and hopefully that works out well. And
What are we asking in the survey?
so we, according to the Gatekeeper program, how we formed it, we wanted to get a baseline about how many seniors are active, and we wanted some information about how aware the seniors are about the services that are provided in their cities or in the county, and just to get an idea of their quality of life or living conditions. And the idea was to send a survey once the program starts, and a survey towards the end of the program, so we see if there's been some positive change through the Gatekeeper program towards the seniors. And also, yeah, basically to have a baseline. That will help us with tracking the effect the program has.
Is there already a kind of a validated tool to measure those things? Other surveys so that you're making sure the wording's correct?
Yes. So Mr. Rod Howard provided me with a lot of questions, and that helped me form the survey, but...
Purpose questions.
Yeah.
Purpose question?
Purpose.
Oh, okay.
CDC.
And I guess we can gauge it more if we get the surveys back, and also the second round that we send out, then we can have some good results to share about the program. I've not added this topic on the agenda, but I was just wondering if either Janine or Francie could share. You guys went for the Living Well training classes. Is there anything you'd like to share, how the experience was?
I think we're very excited about getting it up and running. It seems like a great program.
Yeah.
This
Yeah,
is self-management of people with chronic pain.
Right. Yeah. And we were at the expo, and Arvinder and myself both took interest lists, and we had about 10 on mine, and I don't know how many you had.
I had 4, but I had for the diabetes.
Oh, fears for diabetes, okay. And so we're kind of like, okay, now time to run an ad and see, like, gather more. But Janine shared that she thought Juanita might already have people in the referral or something like that. So before we put out an ad, we thought we'd try to see if there's still already internal people, and we can get a class from that. And that's all we're really waiting for, because if we take this interest list in those people and find out they all like Thursday, or 10 or 12 of them like Thursday at blah, 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 then we'll go for that and get one class started. And I think that the word of mouth on it will be really good, and then we'll go ahead and groom and look for second classes. But with everything that's going on with the opioid stuff and everything, and we're just really thinking it's timely and great program. And if it's okay, I'll just add this on. I just got the Chief Grindle agreed that the town of Lakeview and Prevention and Wellness and Lake Health District will participate in the National Drug Take-Back Program this year on April 29th. So we will be there. You will be able to take all prescription drugs that are old. There'll be a push about, this is where most people are, a lot of kids are getting their drugs right out of the bathroom and your own cabinet, let's get rid of them. And there'll be that kind of a publicity push, and we'll get them packaged up and sent away. So we're real excited to have that partnership. Yeah, we'll let you guys know, make sure you know when that's happening.
What date was that again?
April 29th. It's from 10 to 2, and it will be there at the police station. So.
And where?
At the police station.
Oh, okay.
So that goes through us really with this whole opioid and the chronic pain.
Yeah.
I just think that we're being really proactive here, and
Yeah.
I'm excited about that. And I'm looking for something, I haven't found it yet, but in my former position, they got a clear window cling, and it said, we participate in the drug take-back program. There's no drugs on board, or there's no drugs in our, and I thought if we can find one like that, that would be a great tool to help maybe reduce people from just like, oh, let's go in there, they're older, and or they just had, whatever happened, and so let's go in and rob their house. But I haven't found it yet, so I'm working on it. So if you've ever seen anything like that, let me know.
I can just add that the district is looking, there are some new drop-off drug containers. They become bolted to the ground so they cannot be stolen. Because it's hard right now, not everyone knows. You used to think, oh, if somebody died or they had a bunch of drugs, just put them into the toilet, flush them down the toilet. Well, that just ruins our water supply. So that's not a great idea. And you can't just get rid of them. So we are looking at getting specific boxes where you can drop off old unused drugs. And we're looking for a location right now.
Yeah, I talked to Teresa this last week, so that's good. Yeah, it's
so
there.
that will really help, because a lot of people just simply have drugs that they don't know what to do with.
Well, pharmacies and police stations are supposed to be drug drop-off points all the time, not just on April 29th.
Yeah.
But they don't always are able to accommodate.
Right.
That's one of the problems that we get into.
And there is a drop box at the sheriff's office now, but that's not the same as doing a big push. And the DEA will actually pay for a bunch of stuff, and they'll pay to have this stuff shipped away and everything. And so that's
Yeah, that's good, but people do need to know, just on a day-to-day basis, where to dispose to.
I left the drop-off location going on at the police department, but I'm not sure anybody knew about it, that you could stuff them into the end of the thing there. But unfortunately, you've got to have you've got to have somebody there, you've got to have a commissioned police officer there at all times. And, on my drug take-back day last time, it was pretty funny. Somebody needed to go shopping. He didn't know I was watching him. But yeah, he came in for some other reason. He started looking in the box, and I just popped out there. Can I help you? But so yeah, unfortunately, it does have to be secured. Those boxes were real. The boxes were very expensive. That's part of the reason why we didn't look into it.
Is that what they call Skittles? I think that's what the kids do.
The plastic Ziploc that's got the mix of pills in it. That's what they call it, Skittles. Or trail mix too. They call it that.
Yeah.
That's a party.
Drop off pickup.
I'm behind mine.
We thought it was peanuts and chocolate.
Yes, I did. Good thing I didn't ask for any.
Thank you, Janine and Francie, for the update. Rochelle, can you give us some food code updates?
Sure. Great. So continuing to teach the 7 to 10 classes per week. going well. Today I had kindergartners eating all the different plant parts. So we had them munching on celery and tomatoes and sunflower seeds and arugula. So that was, yeah, it went well. Just sort of an example of what I'm up to on the day-to-day. In terms of cafeteria, we had taste tests in February for both schools. So we had the berry beet smoothie taste test, and it went over really well. We had about, let's see, it was like 62% at Union said they loved it. Their courses were tried it, liked it, loved it for the survey at the end. And then at 80 Hay, we had 59% say they loved it. And yeah, at 80 Hay, I was really pleased with, we ended up shifting, so I wasn't on the lunch line, but I was rather kind of in this like separate table, which I think made it a little bit more exciting. And so we ended up having over 250 kids participate, which was awesome. Yeah, and overwhelming, yeah, positivity on that, which is really cool. More so than the adults, honestly. So, but, yeah, let's see. We have a second grub club, so the after-school cooking club at the OSU Extension office is going to be taking place not next week, but the following week. So that'll be the second one for that. We are opening that up to second and third grade students. We had 11 participate last time, so we're gonna shoot for 15 this time. Advertising in like the newspaper and on Facebook and giving out flyers in classes and things. So yeah, we had a winter vegetable theme last time, so we made cauliflower crust pizza and spaghetti squash tater tots and carrot muffins. And then this next time we're gonna do kind of like a global cooking theme, and so gonna do like hummus and pupusas, like stuffed tortillas. Pupusas, they're El Salvadorian. They're just like stuffed tortillas.
You're lucky kindergartners can't organize.
Yeah.
They would revolt.
Yeah, so,
Squash.
yeah, unfortunately.
Tater tots.
I'd love to go to that class. It sounds like a lot of fun.
Yeah, it's fun to have the kids after school, and then the kind of the idea with that, with the second and third grade, is that they'll then transition into the fourth grade 4-H cooking club. So yeah, that's the idea there. But yeah, hopefully those clubs will continue monthly through the remainder of the school year. Me and Sing attended a training with Food Corps in Eugene in mid-February, so we were there with ODA, and we were Oregon Department of Agriculture, which is the state partner for Food Corps in Oregon, and we got some information about the recruitment process, or just applicants and interviewing folks or potential service members for next year, since we won't be here next year. And then also Food Corps National, so it's a national nonprofit, and some folks from the national office as well as folks from ODA are going to come visit Lakeview in May, which is very exciting. So they're going to do a national site visit here to kind of see what we've been up to since this is the first year that Food Corps has been in Lakeview. Last thing is that with it being like so warm these days, these past few days, there's been some talk, or I mean there's continuing talk of really vamping up the garden projects. So we've got Union just chugging along, doing great. They've got a lot of support and a really kind of like robust gardening committee at that school. At Fremont 80 Hay, it's less so, but me and Susan Warner are going to be meeting tomorrow, I hope, to discuss getting those grant materials ordered, so that farm school grant. Still quite a bit of money to be spent on that, so I'm definitely going to be doing my best to support making those purchases and those orders happen to get those gardens up and going. But along with that, I did want to present a question to the group. If anyone had any like connections, like family connections or friend, community members that they know of who work in construction or would have any desire in like donating skills or labor or even materials to assist with the Fremont Garden project. I know like Jasco Construction is helping out with the union greenhouse construction, but
Flower, raised flower, or
yeah, the raised beds, yeah, hopefully a deer fence as well.
then get the farm supply to donate the wire fencing, and you can do a trellis across between the beds.
Yeah, is Farm Supply a company?
No, if you have farm supply that has like fence panels, you just use that. It's like an 8-foot panel, you just stretch it across the
You're
bed.
saying sort of like a hoop over
Yep.
each individual bed? Yeah, that's
From
something
one bed to
alternate
the other even.
in terms of, yeah, protecting against deer. Yeah, does anyone know of any people or? Yeah, okay, we know everyone, Albertson.
What about the prison? Do they have anyone like that?
Because they have that garden program for people too.
Yeah, they have a lot of, they're really good at growing certain things and vegetables too. I think they would, but they also have a shop out there. I think they build things. Yes.
If you can make the next UPIC meeting, they have somebody coming, they have a representative coming to the UPIC if you manage to make that one.
Yeah, I could make a couple part of it.
Maybe, yeah.
And in
My
talking,
boyfriend is a lieutenant out there, so I'll talk to you about
Okay.
the whole thing.
Jake Greer might have some people that could
They have a
volunteer
working group.
or assist.
I don't know if there's any issues with them being.
Probation, I don't.
No.
But Rochelle, you're Jeff Samples in the WIA group. You might talk to them about it too, right?
The COA.
Yeah,
Yeah,
WIA.
okay, yeah. Any, do you think True Value would go with
They probably will, because they're doing so much for the community.
They probably will, or they probably won't?
They will.
They will,
Yeah.
okay. Yeah,
I don't
guess
think
yeah,
that they
talk
would.
with them.
Well, we have 2 hardware
Exactly.
Thank you, yeah, that's it.
Do you know if the school gardens will be up and running before the meeting this year?
See you again. Yeah.
How long are you here?
Through July 31st.
Rachel, you may want to talk to the 39er,
Okay.
because they are super at donating to our causes.
Okay. Do they have like garden
If
tools
they
or
don't know,
some kind of-
if they don't have, they probably could make a scholarship or money donation
Yeah.
towards it.
Mike Beeson of the 39er is very resourceful in finding whatever he needs or wants.
Yes.
Very
Exactly.
resourceful.
Exactly.
That's the way his
Thank
brain
you.
works.
Thank you, Rochelle.
Yeah, thanks, everyone.
Ron, did you want to say anything about stuff that you're working on?
I was working with our vendor on that project, and I don't know, eventually we're looking at having those that are working with older adults in this community coming together as part of a collaborative. And I have several modules that I can present at those meetings. I'll be getting trained as an older adult behavioral health, not an older adult. I drove almost 6 hours, sorry. As a mental health first aid instructor. So, and then eventually getting certified doing the senior one too. So that's part of the plan. If you haven't got a chance to look at Bilby's spring conference coming up in May, I've looked at that as something for you to attend. One of the speakers that I've worked at bringing in is presenting on having complex care conversations, which really then helps people work through making difficult decisions. Excellent training. I brought them to Pendleton back when I lived there, tying in with palliative care, and we trained all of our providers there on that. And so now we're bringing it to the Bilby conference. eventually I'll be being trained as a instructor on that too, so they go out to different communities.
Patrick Kennedy is the keynote speaker at that meeting.
Yeah.
It's gonna
Who's
be-
Patrick Kennedy?
Ted's son was a congressman and was the promoter of health equity between mental health and physical health. He's had some addictions and mental health problems himself, along with exposing parts of the rest of the Kennedy clan with some of the problems that they've had. So he'll be a big draw. The other
Trains in Bend too, so it's not that.
yeah, the other aging one, though, is the first annual
Yes.
Forum on Aging in Rural Oregon, is going to be up in Hood River, and it's sponsored by OHSU's Office of Rural Health. So, I mean, when Rod came here 4 or 5 months ago when he started the job, and he showed you the numbers about what rural Oregon looks like in terms of aging and our percentage of people and mental health as part of that, along with the supports that people need through things like the Gatekeepers program. You know, you guys have already identified senior health as a priority for this LCAC, which is outside of Medicaid, but, you know, certainly fits with what your community needs are. So I'm sure that's circulated around, Charlie, the meeting, but I can get it to our vendor if you haven't seen it.
I'll actually be sitting on a panel on that too, talking about the needs of
Okay.
rural communities, so.
Thank you. Do other members have specific things they'd like to bring up, talk about that their agency is working on, or challenges or opportunities?
Can we brag?
I don't know. Can you?
May I brag?
Absolutely.
I'd just like to say that, you know, last time you were here, Nate, that I was here, I think I missed a meeting, was you talked about they weren't going to allow opioids to be
Prescribed for lower back
thank you,
pain.
yes.
Yes.
And I said, what about yoga? And you said, no, they didn't include yoga. And did you see the new study that came out that put yoga in that? I was like, yeah, I just wanted to send it to you, but I didn't have your email, so I'm like, oh, I want to.
No, I think the Health Evidence Review Commission
Yeah.
at the state recognized the benefits of yoga.
Yeah. They didn't put it in the
problem
list.
is that you're not really a licensed yoga person. They'll provide, you know, you can say that you do massage too, but unless you're a licensed massage therapist, then how can we have a contract? And there could be people who claim to be yoga, but there's no, like, certification
Yeah, there is.
process for it. Well,
But anyway, that's not my point. My brag
yoga
was,
works.
my brag was that we have a gentle yoga, a staff yoga, an evening yoga, and they're all full. And they start next week, and I'm just really excited that we have that opportunity to reach out to our community. We also have a Mommy and Me, which isn't full yet, but we'll see. And we're gonna use those as opportunities to, you know, press forward on all these health issues that you guys bring up or whatever we need. It's just another way for us to reach out to the community. I'm really excited about that.
I think that study it shows that it relieves depression, and they were saying that they were thinking a big part of it was just even breathing that they were teaching.
I also saw last month goat yoga. Did you see that?
Goats do yoga?
Well, no, they just let goats climb over you while you're doing your yoga. It's very popular.
I'm sure that's.
Look it up. What?
Cat
You
yoga and bunny yoga, and you go do yoga in a room full of cats and full of, yep, it's a thing.
My dog would work.
Great. All those that enjoy goat yoga, you just knocked yourself out. I know that doing exercising with a puppy
Yeah.
is really difficult because the puppy thinks
It is.
you're playing.
Yes, that's right.
So,
That's where down dog came
You
from.
can get a lot of
if we don't have any other issues, we thank you.
Charlie, I just wanted, just to throw out to the benefit of the group, the Grant County Local Community Advisory Council actually had somebody conduct an ages and stages questionnaire developmental screen for a 2-year-old in front of the group. They hadn't seen how the process works, and everybody just was enamored with the process of,
The 2-year-old or
I think that's what they had, the 2-year-old, no, I mean, there was a certified provider who went through the screen so that they could see how a developmental screen works, and I just thought I'd pass that along if we ever need something that could, I'm sure we could find somebody who'd be willing to have somebody go
is that
through
something
it.
we could arrange?
Probably, I can
That would be a great thing, I think. We could, I mean, how many people have ever seen it done?
For a 2-year-old.
Well, we got one hand, I didn't see any others. 2 hands. But to chance to see it and to understand a little bit more about that.
Zippers
A
and
very
buttons and.
good show and tell. I mean,
That's essentially what they did, and people really just thought it was great to actually see it happen.
Oh, yeah, cool.
That's
I
a
just
great
thought I'd
idea.
pass that along.
Yeah.
Thank you. That's something you can do.
And so Ann's coming next week, or next
So
week?
next meeting,
And,
she requested.
yeah, and Estella wants to come too.
Excellent. So we'll need to put that on the agenda. So we have a lot of work ahead of us. Thank you, everyone, for your time. We're a little early, but that's always a good thing.
Yeah. Next
We're
meeting.